On that note, International Nurses Day is being celebrated today, as you heard, in honor of those who give their time and lives to the health sector and those in their care. The day also highlights the conditions under which nurses work and what is needed to address concerns within the sector. Meanwhile, the Young Nurses Indaba trade union has called on all nurses to boycott International Nurses Day, saying the industry is under attack and essentially there is nothing to celebrate. For more on this, I'm having a conversation with Simphiwe Gada from Denosa, Lerato Mthunzi from the Young Nurses Indaba trade union. Welcome Mnisi from Nehawu and Dr. Nonhlanhla Makhanya from the health department. They all join us now virtually. Thank you very much to all of you for joining us. Let me start with you, Ms. Mnisi. You manage basically the nursing division in the health department nationally. With all that's been happening, do you really think that government is appreciative of the work of the nurse? I'm not sure if Ms. Makhanya can hear me. Ms. Makhanya, just confirm for us very quickly whether or not you can hear me. Nonhlanhla Makhanya.
Yes, I can hear you loud and clear.
Okay, great. So I just, with all that's been happening with nurses protesting against different provincial health departments, etc., or against managements at their hospitals, what's your thought in terms of the person who manages nurses in the National Health Department? Do you really think that government is appreciative of their work?
Thank you for the opportunity, and today is the International Nurses Day, and it's a day to celebrate nursing contribution towards improvement of the healthcare system. While we appreciate that there are challenges, we are quite confident that there are systems and structures in place to deal with those challenges that affect health workers in general and nurses in particular. However, we use this day to really pay tribute to the unsung heroes who continue to do the good work despite adverse conditions.
Lerato, let me come to you in response to what Nonhlanhla just said in terms of, yes, challenges are there, but she says it should be celebrated today. Do you feel celebrated, or do you think that it's just this one day where they expect you to celebrate, but all the other days you are not being celebrated at all?
To be very honest, if we are to celebrate going to work and becoming accomplice to matter, going to work and working in a system that does not enable nurses to be able to assist their patient effectively, and we continue giving substandard of care, for us it's not something to celebrate. We've chosen to use this day rather to say let's stop and observe the fact that our healthcare workers are working in really bad conditions. The material resources are not there. Human resources is not there. The government is letting go of this stuff. The very unsung heroes that Dr. Makhanya is making reference to, the very people we hailed as heroes as the country, we have managed to tell them to go to hell, in short. And today we cannot find ourselves putting up a facade and saying, let's celebrate. There's absolutely nothing to celebrate in South Africa, internationally, perhaps in other countries where they've received proper recognition, where the conditions of work have been looked at, where their regulatory bodies are coming to the party to make sure that education is uplifted and the practice is improved. Perhaps they have something to celebrate. But with us, we've taken plight. As I'm speaking to you, we are in the offices of the regulatory body at SANC, and we want SANC to stop and listen and hear that nurses are not happy. They're not happy with practice. They're also not happy with the snail pace in which they're taking to upskill them, to develop them and make sure they're able to give quality care. Like I said, nurses are just saying we are tired of going to work to just watch patients die because we cannot overstretch ourselves, because we can only help one patient at a time. It's just a bad situation for us that we don't think there's anything to celebrate. Before the pandemic, during the pandemic, it became worse, and now we still find ourselves in a very much a precarious position where we don't see anything to celebrate, but rather we want to fold our sleeves and be able to fight and be able to fix what is happening in the healthcare system.
Dr. Makhanya, let me come back to you to just give you the chance to respond to Lerato saying that you as government are basically telling nurses to go to hell. She says you're putting up a facade.
Oh. Thank you. That government is telling nurses to go to hell. Probably I cannot really attest to that. It's a view that is expressed by Lerato as Young Nurses Indaba.
And you're not putting up a facade. I mean, if you look at the ratio, partly, the government has already admitted to the fact that the ratio of nurses to patients is problematic. We've seen nurses, basically saying that one nurse is expected to look after 5 to 6, 7 patients when the ratio is supposed to be less. So wouldn't you say that government is actually not doing enough, and to just put this one day aside, expecting nurses to celebrate when they've been crying out to government to say we need help? Wouldn't you agree with what she's saying in terms of putting up a facade?
Maybe let's not confound issues. The International Nurses Day does not really mean that there are no challenges in terms of health service delivery. And the fact that the issues, the complex issue that arises from a number of factors affect what nurses do. However, we really say, despite those challenges, we use this dedicated day of May the 12th to actually sit back and commend nurses, and particularly because it's attributed to some of the pioneers of the nurses who were experiencing the same way back in terms of tending for soldiers in unconducive environment. However, we sit back on this day and say, let's just celebrate and say, we realize your contribution. It matters. It makes a difference in the lives of the individual. It may not be making that much of difference in terms of your living conditions and subsistence as nurses.
All right, let me bring in Simphiwe Gada from Denosa then. Simphiwe, hearing our other two guests talking about, whether or not today should be celebrated, etc., and the plight of the nurse, what is Denosa's stance on celebrating International Nurses Day when nurses are saying, why celebrate us on that particular day when you can't assist us with the things that we've been asking you to assist us with?
Well, thanks. Our view is that the day is celebrating the profession itself. We're not dismissing the challenges that are there. And our stance is that, nurses deserve to celebrate the successes that they themselves have done, have achieved in order to put the nursing profession in the map. I mean, nurses were at the forefront in protecting this country and, fighting COVID-19, ensuring that our healthcare system does not, collapse. So nurses deserve to celebrate that. However, government does not deserve to celebrate the Nurses Day because we have seen that the nursing profession has been under attack by government. So nurses deserve to celebrate on their own, and we don't think that government does deserve the right to celebrate the Nurses Day because we've seen that government has been attacking nursing. If you look at the nursing education, it is in tatters. If you look at the working conditions, they continue to experience challenges of understaffing, no tools of trade. We also see a shortage of medication in other instances. So government can only celebrate this day when they correctly acknowledge the role that is played by nurses in terms of ensuring that the healthcare sector, is fully functional, by recognizing the role that has been played by nurses in the fight against COVID, by giving nurses, recognition, and also by adhering to the implementation of collective bargaining and paying nurses what is due to them, and also employing those nurses that they've trained. So up until they meet those demands, then government cannot speak, from a high horse and say that they are celebrating nurses. Nurses must celebrate themselves and celebrate what they have contributed into the profession, because the profession is where it is because of the contribution of nurses, not because of the contribution of government. So as we speak, that is why we're calling for investment. Government has got to invest in nursing, and only then they will have the right to celebrate nursing.
All right, well, let me bring you back then, Dr. Makhanya, because that also deserves your response. Mr. Gada saying that, yes, the profession should be celebrated, but government, using the word attacking the profession, has no right to celebrate with the nurses.
Thank you. We need to understand that if you look at the health and the healthcare system, the most beneficiaries of the health system are the healthcare users across the levels of care. And those are the people that as government, we feel that every day for 24 hours, irrespective of the conditions, we have nurses in this country who chose to be nurses, who are still committed to serve their patients. And this is the day that we set aside to say thank you on behalf of the healthcare users, because nurses are with the patients throughout 24 hours, notwithstanding the challenges that colleagues have highlighted. But despite those challenges, there is never a moment, very few probably, from our patients who are the most beneficiaries of the nursing care, that they get an opportunity to say thank you.
Let me bring in Mr. Mnisi. Welcome, Mnisi, from Nehawu. Mr. Mnisi, I don't know if you've been able to listen to what everybody has had to say so far, but, in terms of what Dr. Makhanya had to say, saying that there are challenges, but nurses are there because it's a calling. I've heard a lot of nurses saying that, government keeps on saying that it's a calling, as if they must take all the challenges that are happening in the industry just because it's a calling. What's your response to that? I see your epaulets there. I see you're also a nurse. Do you feel appreciated? Do you think this calling means that you must take everything else that is facing nurses in terms of challenges?
Thank you very much, my sister, and good afternoon to all the listeners and the viewers, Tom. What we can say as Nehawu is that this issue of saying nursing is a calling is the very same thing which makes the employer to abandon its responsibility to look after nurses. As we speak now, if you can visit all healthcare institutions, you will find that there are challenges confronting nurses there. The safety of nurses throughout the country, including areas in the peripheries, is compromised. How many nurses on a daily basis are being attacked by members of the society, including thugs who just came to the hospitals and healthcare facilities to get service? There is issues of non-nursing duties, which our nurses, they end up finding themselves doing those particular duties, which are not aimed at being done by nurses. Infrastructural challenges are there. There's a gross attack on collective bargaining. And you must remember that nurses are also the public servants who, as we speak now, their morale is down because the employer in 2020 decided that they should renege in terms of the implementation of Resolution 1 of 2018, Clause 3.3. These are the very same nurses that must be celebrated today. That's why we're saying this issue of the employer, of keep on saying nursing is a calling, is the one very same thing that makes the employer not to look after these nurses. We are urging the employer to continue taking care of nurses, appreciating them. As we speak now, how many nurses are coming from isolations? How many nurses are coming from quarantine? Some have passed on and have not been appreciated for the work that they've done since 2020 when there was COVID-19. So we're saying that the employer should keep on looking after nurses. Nurses, as we speak now in institutions, they are understaffed, they are overworked. A nurse is doing the work of more than 10 people. And then we must celebrate and say nursing is a calling. No, nursing, yes, it might be a calling, but these nurses are workers, and workers must be taken care of. And the biggest employer in the country, which is government, must take care of these workers, must look after these workers, including the working environment which they find themselves working under. Nurses, on a daily basis, they are in conflict with members of the society, because each and every time they come to a public healthcare institution, they find that there are challenges within there. And the very first person to be attacked is a nurse. So all those issues must be attended to by the employer. Yes, we see this 2025 target which has been set by the employer. They must make sure that they employ all healthcare professionals so that public healthcare services are being rendered to members of the society.
Dr. Makhanya, your response to that, what is perhaps, maybe you can share with us exactly what it is that is a stumbling block for government to be able to meet its promises that they make at bargaining councils, etc. And, what's the stumbling block in terms of the things that the nurses ask for more staff, in terms of assistance, etc.?
I may not be better placed to speak on matters of on issues that take place in the bargaining chamber, because the department is represented by a different person in those platforms. However, I am quite aware that the issues of conditions of service are integral to the discussions that take place in the bargaining chamber, and there are a number of resolutions that get to be taken there that gets to be implemented progressively within the department, within the sector broadly. So basically, from where I am seated, I would not be better placed to really engage on matters of bargaining that are sitting in the bargaining chamber, because there are mechanisms that deal with those matters.
And Dr. Makhanya, during the time that you were a nurse, if you were ever a nurse, if you started there, and even if maybe you were practicing as a doctor at public facilities, were you happy with the state of our public hospitals?
I chose to be a nurse because for me, nursing is a career, it's a profession, it's a platform. It's a platform where one can be able to be of service to humanity by looking and tendering to the healthcare needs of our patients. So that was the motivation for me to join the nursing profession. And I've worked through the sectors within the nursing profession, from providing primary healthcare to being in the education sector, and to where I am now seated in terms of policy formulation. And there are a number of policies that one has influenced, driven the development thereof, that really looks into a number of.
All right, we'll definitely go back. We're hoping that Dr. Nonhlanhla Makhanya will be able to rejoin. She is in the Department of National Health. She's the Chief Nursing Officer. Of course, we need to just give her some time to also respond to what the different people who are speaking to us today are saying. Let me come to you, Mr. Gada, in terms of what our the two other unions have said so far, Wainitu as well as Nehawu. I think a lot of people would agree that, what's unfair is that every time something goes wrong in a hospital, the first person to be blamed is the nurse.
Well, unfortunately, that is how our society has been socialized, in that nurses are seen as people who do everything in the hospital. And that attitude has got to change. People need to understand that for a hospital to run, there are many departments that get to have different roles that are played. And people must not go and make nurses the easy target that they should place the blame on. However, you cannot also, entirely blame society. This is also based on the fact that our government is not doing enough to also uplift the nursing profession. I mean, ourselves as nursing unions, we are doing the best we can in terms of uplifting the profession. But the profession, it's what I spoke to earlier, to say that government does not have the right to celebrate this day because they are not doing enough to acknowledge the role and also to acknowledge the importance of nursing in the profession, in the country, and also in the entire healthcare system. They've got to understand and also give credit where it's due. For instance, you would recall that I think about a year or 2 years back, there was a story that broke out in Mamelodi where a nurse was accused of having tied a woman onto a bench. Well, not many media houses, including government, followed that story to its logical conclusion when the nurse was exonerated. So it's a matter that also we want to appeal to the media that when stories about bad things break out, the media has got to follow those stories up until they are concluded, because in many instances, it's easy to just throw allegations at nurses and not follow those allegations until the nurses are exonerated. So it's something that requires all stakeholders to understand that nursing requires the support, of many stakeholders, of many players, because nursing remains central in ensuring that, our healthcare system continues to function. Because without nursing, we would not be having a healthcare system in this country. It would have long collapsed. It is nursing continue to hold the fort.
All right, let me just go back to Dr. Makhanya. I think she's back with us now. Doc, just very quickly, earlier I asked you, you did answer that you chose to become a nurse because of the calling and your passion for it. That wasn't my question. My question is that throughout the time that you've been in the public health system or the health fraternity, are you happy with the state of our hospitals and clinics in South Africa, particularly public health?
Thank you. I'm not sure at what point I got to be cut off. However, everyone is quite aware that there is so much that can be improved in terms of the current status of the healthcare system. It is quite concerning because of the number of challenges that we are quite aware from the changing context of care, the load of patient care that we are seeing, and the chronic shortage of nurses, as my colleagues have alluded to. So all of this really actually place an undue burden, particularly the burden that get to be felt by nurses, who are the only healthcare professionals that are with the patient for 24 hours.
Well, thank you to all of you. I was hoping to have a little bit more time, but unfortunately we've run out of time. But thank you very much for that robust conversation. That was Simphiwe Gada from Denosa, Lerato Mthunzi from the Young Nurses Indaba Trade Union. Welcome Mnisi is from Nehawu, as well as Dr. Nonhlanhla Makhanya from the Health Department.